I can confirm we have 41 new cases of coronavirus in the last 24 hours in Victoria. That takes us to a total of 1,987, which is an overall increase of 40. One case was reclassified yesterday during investigations. Of those 41 at the moment, 8 we know are linked to outbreaks. 1 is detected in hotel quarantine. A further 13 have been detected through routine testing. So as yesterday, they're not in hotel quarantine, but they may well still be linked to outbreaks as investigations continue. And another 19 are under investigation. We currently have 260 cases that indicate they are community transmission. We don't have a clear source for those cases, so that's an increase of 15 since yesterday. We have 204 active cases in Victoria. 5 of those are in hospital and 1 of those 5 is in intensive care. 1,761 have recovered and we've had no further deaths from coronavirus in Victoria. Total of 758,672 tests have been received, which is an increase of over 21,000 since yesterday, which is really pleasing to see that so many people are getting tested. In fact, it's closer to 22,000 since yesterday. In terms of other news for today, we will be sending and have already started sending an emergency alert to residents of the suburbs of Kielor Downs and Broadmeadows. So as part of the Blitz, this alert has been issued to let communities in those hotspots know that there are testing vans, there are door knockers and expanded community engagement teams in their area and to please get tested. If people would like to see an example of that text message, it's up on the Emergency Victoria website, but I believe multiple media outlets have already put pictures up of that so that people can confirm that is the correct message, and we encourage people in those areas to continue to go and get tested, and for those hotspot suburbs that testing continues to be available for people who are symptomatic and asymptomatic, and for the rest of Victoria the message really does remain: if you are symptomatic, please get tested straight away in any one of our testing centres through your GP or through other respiratory clinics at hospitals or other general practice settings. So I'll leave it at that and take any questions.
Are we, in those cases, are we starting to see the results from the suburb by suburb testing yet, or not yet?
Some of them will be from the suburb by suburb testing. We had been standing testing sites up in those suburbs throughout the week. Obviously the big blitz started on Thursday with community engagement and people knocking on doors, but activities had really started from Sunday and Monday of last week, so some of those will be due to that. I don't have an exact number of how many of the overnight cases are symptomatic or asymptomatic due to the blitz, no.
Yeah, can you talk us through, we understand there is one positive test from a hospital and also another couple from schools. Can you tell us about those?
So look, we've got a process, a comprehensive process that is undertaken with all tests, and previously effectively all indeterminate tests were really treated as positive so that we could just be extremely cautious. Obviously now we have a whole lot more data from across the country and across the world, which has enabled our colleagues at the laboratories to really fine-tune that process a little bit more, which means now some tests, when they are very low positive or indeterminate, are being reviewed, retested, re-looked at by a number of experts and panels and considered in conjunction with all of the other evidence around that case, and some are being then classified as negative tests, or as you said, that the first test was a false positive. So that's a process that's occurring in other states as well, and New South Wales have spoken about that pretty extensively this week.
41 new cases, the 11th consecutive day of double-digit numbers. How concerned are you?
Obviously we are quite concerned, and that is why we have ramped up these efforts to really, really find every possible case that we can find in these areas where the majority of these cases are coming. So we are, we're very concerned.
Do you think hotel quarantine testing should be mandatory like what we're seeing with other states?
So hotel quarantine is a major aspect of our of our work to keep COVID really out of Australia, it has been enormously successful in decreasing the number of cases that are imported into our communities. Victoria has led the way on testing policy in hotel quarantine. We were the first to start any form of routine testing. We were the first to start double hotel testing. The HPPC statement is broadly based on the policy that we pioneered. In terms of whether it is mandatory or not, every state and territory is really working under, broadly similar but different regulatory and legal frameworks, and we are seeking legal advice on that. The evidence in Victoria remains that we have not had community cases or community transmission linked to people leaving hotel quarantine, that the current program is really very successful. So whether it becomes mandatory or not, there's a really large number of questions. And we are continually working on our processes to really encourage people to uptake the testing that is offered to them in Victorian hotels.
Would you like to see what's happening in New South Wales? They've announced today that if someone wants to be released, they haven't had a test, they've got to stay another 10 days. Would you like something like that?
Look, we have a testing program in our hotels. I wouldn't have implemented the testing program if we didn't think that that was appropriate, so we would like to see as many people in that program to be tested as possible. Equally, detaining people has ramifications, and so our preference is that people are detained for as least amount of time as possible, and we're working hard to try and make sure that that is the case.
Do you think if everyone was getting tested on the way in, would that better help us manage it potentially spreading to security guards?
So look, like I said, everybody is being offered testing on the way in, everybody's being offered testing on the way out, and we have had some cases in some breaches in security, which has resulted in some cases and outbreaks. Testing or not testing people isn't what's happened to cause those. Those are infection control issues and that are being addressed and have been addressed. And the evidence remains that we're not seeing cases in our community that have, for want of a better word, leaked out of hotel quarantine because they haven't been tested. We're just not seeing them. So we need to put our effort where we're seeing cases. Where we're seeing cases in these suburbs that we're doing the blitz, in these hotspot suburbs. So that's really where the cases are.
Why would people, 30% of people, why would they say no to testing?
Look, I'm not going to discuss the reasons people may or may not wish to be tested. That was an estimated number. There's certainly lots of other reasons why they may or may not wish for that to happen, but certainly my understanding is now that number is actually higher than it was, and that number was from the entire program, and that in recent weeks it's been significantly higher. I don't have that exact data on me at the moment. It's a complex and difficult data to extract, but we are working hard to increase that uptake.
The 41 new cases, are we still seeing them in the same areas, or is there any spread into other parts of Melbourne or Victoria?
Yeah, look, at the moment, look over all of the results that have come in overnight, they really are predominantly in those inner northwest corridor suburbs, and so really in those hotspot suburbs that we're looking at, and in those LGAs that have been being discussed in the last week. So we're not seeing any real uptick in cases at the moment in those other areas of Melbourne.
Have we seen any cases of travellers picking up coronavirus while in the hotels?
Not that I'm aware of.
Can you give us any clarity around when police and PSOs are meant to start guarding the hotel quarantine zone?
No, sorry, I'm not that involved in the immediate operational requirements of what's going on in terms of who's coming in or out from that perspective. Sorry, we can look to come back to you.
Given that troops are no longer involved in that process, and we've currently got private security guards there, obviously we've seen the cluster with security guards, how important is it, do you think, that police and PSOs become involved immediately?
Like I said, I haven't been involved in the absolute operational decisions as to who is undertaking that work in hotel quarantine. My priority is that the infection control procedures and policies that we've put in place as needing to happen are able to be undertaken to the best of their ability. How that is implemented is really left to the teams that are implementing it.
You've said before that in Victoria we don't test the hotel travellers on the day that they're leaving. Can you talk us through what days we do test them and what the logic is for doing it on those days?
So at the moment our testing regimen is day 3 and day 11. Day 11 because There needs to be a balance between people actually being able to leave and getting test results back, but also a very comprehensive review. And if you've all seen the AHPPC statement, it says that people should be tested between day 10 and 13. So some people are doing day 10, for example, New South Wales. We're doing day 11. So that is really, the review of the evidence showed that the vast majority of people, if not all of the people, will actually be will come up positive by day 10. The 14 days already is a conservative number of days in terms of making sure that absolutely everybody is captured in that 14 days.
You said 8 were linked to outbreaks. Can you explain which of those outbreaks were linked to?
So look, that's getting a little bit complicated because we do have quite a number of outbreaks at the moment, but certainly 3 of the new cases are linked to the North Melbourne family outbreak, and 1 is linked to the Woolert outbreak. 2 new cases are linked to the Alban Vale Primary School, which has been mentioned previously. 1 is linked to the Stamford Plaza, and 1 is linked to the Kielor Downs outbreak. All bar 1 are close contacts who'd been identified who were already in quarantine at the time of their diagnosis.
And are there any other schools or hospitals where there have been new cases today identified?
There has been a number of schools over the last couple of days. As you'll appreciate, we've had 65 odd cases. I don't have the exact names of every school. It's school holidays now, so all schools are closed for the next 2 weeks, and any close contacts in those schools will clearly be contacted and asked to be in quarantine for that 14-day period, but children won't be returning to school obviously after today for 2 weeks anyway.
And the Dandenong Hospital, we've heard that the staff has tested positive there.
I'm not aware of a staff member at Dandenong Hospital. As I said, there are 19 cases still under investigation, all of which came in after 11 p.m. last night, so the team are still working everything up.
I understand
clarifying the Stamford Plaza, the 1 new case, is that relating to a staff member?
I believe it is, not sure what the relation is, but it was an existing close contact. So it is a close contact of someone who was already linked to that outbreak, who was already in in quarantine at home.
And how many does that now make Stanford?
18.
With the 41 today, it's around about double what we were seeing last week, 7-ish days ago. What does your modelling say? Are we on the way to that really sharp exponential rise?
So I suppose at the moment we don't need modelling to show us that the case numbers are increasing. They're showing us that for themselves. So, we can see that the numbers are going up, and that's not where we want to be. We do know that doing a whole lot more tests may well flush out more cases, so that is to be expected, but obviously our aim for the next couple of weeks is to really find every single case and then get to a point where those cases peak and start going downwards. When that peak might be, I couldn't tell you.
Are we on that exponential trajectory? Or?
We're not. I wouldn't say we're exponential yet, but I haven't looked at it in those exact terms just yet.
Would you describe this as the start of the second wave or not?
Terminology really at this point in time is not that important. Our case numbers are increasing, so when you look at our overall epidemiological curve, there will be, and I'm hoping very soon, a second bump or a second peak, and so that is what this is. Whether we have 2nd, 3rd, 5th, 10th waves, nobody really knows. This is not something any of us have experienced before. We will continue on a suppression strategy, and as our Premier and multiple others have said, we know that cases and outbreaks will continue to occur, and we are really just doing our best to keep absolutely on top of them.
Can you explain to us what the ADF officials are doing here?
They are out on the ground with the people doing community engagement, helping with the testing, helping to do testing, helping with the logistics of all of the testing sites, and around the mobile testing squads and units that have been set up in all of our hotspots.
Why do we need them? Because they're basically doing the same work that civilians are doing at the moment, aren't they?
Yes, I'm sure you will appreciate that testing 100,000 people in very specific spots of the state is a massive logistical exercise, and there's only so fast that you can train people. These guys are stood up, ready to go. The ADF have been involved in this pandemic since the very beginning. They've been deployed to Tasmania, they've been deployed to New South Wales, they've been deployed to a number of other areas. This is part of their remit, and they were more than happy to come.
I believe the North Melbourne family cluster, that's linked to the H&M store, which is linked to the protester. Does it kind of confirm your worst fears from the protest that it was going to spread into
No,
more cases?
no. The evidence that we have with the way the transmission has occurred in that cluster is that the protest was not the seeding event for this, that cluster was well in train before the protest happened, and it is just a coincidence that somebody who was involved in that cluster attended the rally.
So it's just a coincidence that two people that both work at H&M Northland got it. The protester didn't pass it on to his colleague.
Yes, but I'm not going to go into any more details to individual patients at this point in time.
Just going back to the hotel quarantine, are you able to give us a figure of how many cases have come from people in hotel quarantine?
Overall, how many people in hotel quarantine have been diagnosed with COVID?
Yes.
I believe it's over 100, but I would have to double check that exact number. I think it's somewhere between 100 and 200, but we'll have to get back to you on the exact number.
Do you know how many are in hotel quarantine in Victoria right now?
We've had over 19,000 through altogether, and currently we have, not sure, probably 4 to 5,000 at any given time often. Could be anywhere between 3,000 and 5,000 at the moment, but it's a huge exercise. There's a lot of people.
Has the confusion over the ADF coming and going and where they're going, has that in any way impeded your work?
Me? No, I've had very little to do with the logistics of ADF. They asked me what we needed to get testing done, and I said, and that's left to others, to be honest.
But you've asked for specific numbers, and clearly we don't know how many numbers are coming and when they're coming. Like I said, I'm not involved with exactly how many numbers are needed to set up a testing tent. That's not that's not at all my area of expertise. I was asked what kind of expertise we would need. I provided that, and the logistics of who, what and how many and when they come is done by other people.